synchronized at 11:11. There's just something so wonderfully auspicious about 11:11. I'm just that woo-woo type of person, but here we are. Thank you very much for joining us. 11:11 on the digital clock in Central African time. Thank you for tuning in across the African continent via satellite on channel PAS 10. Otherwise, wonderful to see that you have downloaded the Channel Africa app so you can take us with you wherever you go in the world. We continue with conversations and themes that surround Women's Month, especially in this particular African region, if you will, of South Africa. There is a need to put a spotlight on a harsh reality, despite it being largely preventable and treatable. Cervical cancer. It remains a leading cause of cancer-related deaths among South African women aged 15 to 44. That is very, very young, I think. Claiming nearly 6,000 lives every single day. Women living with HIV also bear a disproportionate burden, facing a significant risk or higher risk, as we noted, of developing the disease. There is an urgent need at this time for stakeholders across government and the private sector, as well as civil society and other sectors within the support of this, to strengthen the collective action. So let's unpack this and look at these statistics holistically with a professional who joins us on the line. Salomé Meyer is director at Cancer Alliance. Salomé, thank you very much for your time. Welcome to the program.
Good morning to you, Mmatsheko, and to your listeners.
Thank you very much. Such an important conversation to have, one that is often neglected when we talk about health and wellness for women. What, perhaps you can help us establish, what makes cervical cancer such an urgent health issue in South Africa, especially right now?
Cervical cancer is the most preventable and also the most treatable cancer. And as you have indicated earlier on in the introduction section, we have one woman that dies every 67 minutes, and that's one woman too many.
Yeah.
If we are able to prevent the disease with vaccines, as well as with screening of our women for precancerous lesions, there is no need that a woman has to die.
I think that is exactly the distinction, is really looking at, these statistics, but looking at the fact that this is a preventable disease. Another important note to make, Salomé, is around the intersection of HIV and cervical cancer. I don't know how many of us are actually aware of that, and perhaps you can give us a sense of, what are the critical healthcare approaches and interventions in that particular realm?
So women that are HIV positive have a 6% chance more susceptibility of cervical cancer, and that is mainly due to the fact that they have a compromised immune system. So cervical cancer is caused by the human papilloma virus, so it's a virus. So the two viruses are working against each other. And therefore, it is very important that women living with HIV are screened on a regular basis. So in South Africa, what we have now done is the screening age for women living with HIV has now been lowered to that of 25 years of age. So any women that are living with HIV, it is important that you go back to your primary healthcare facility where you are getting your ARV treatments, whether it's lenacapavir or any of your ARV treatments for your follow-ups. You actually have to make sure that you implore on that primary healthcare facility to do your screening for you. Should you be HPV positive, and that, if I can just mention that is the other brilliant news in South Africa, that we have moved over to HPV screening. So no longer are we doing the old-fashioned pap smear, which is liquid-based cytology, but we're now doing the high-performance HPV test that tests you particularly whether you have HPV. Should you be HPV positive, that primary healthcare facility will then triage you as the woman to then say you now have to go for your precancerous lesion checkup to determine whether you need further treatment or not.
Okay, that is very, very happy new development that you note for us. And I think perhaps we need to address where the gap is. Is the gap in creating awareness, or what exactly is happening, especially when we look at perhaps the main barriers that are preventing women from getting the screenings, as you mentioned them, and getting vaccinated at the right age?
So, first of all, I think our first barrier is the vaccine and getting our girls to be vaccinated. So we do still have a lot of, I want to say, anti-vaxxers or just women and parents that are not informed about the importance that HPV vaccination is indeed available, and that will, in essence, protect your girl to get cervical age. We need to also say to our parents, this is not about sexual activity, that you are now going to say with an HPV vaccine, my daughter is now going to become sexually active. No, this is not about that. This is about a prevention strategy for your daughter at a much older age, because it is the persistent infection with HPV that in fact causes cervical cancer. So that for me is quite important. But if we want to start looking at what is it that we can do in terms of the barriers of women going for screening, I think we need to say here that this is where business can come on board in this strategy. We need women work. So, and that becomes part of the problem. They cannot get off. They have to take leave to go for their cervical cancer screening. So what is it that you, as the business sector in this country, can do to actually promote screening in the workplace? There are many service providers that can actually come on board to your workplace to, in fact, provide screening at the workplace for women. We know that, for instance, with breast cancer, many of that happens also at the workplace. So why can't we do the same for cervical cancer?
Why can't we do the same for cervical cancer? That is so important. And actually, just to build on the idea of really bringing the services to the women in the workplace where they actually spend the most time, if we really think about it on average in this country, bringing the service makes sense. But we've also got to take away the shame. Take away the shame of having these preventative measures coming into the workplace. You know, there's nothing shameful about women getting screenings and getting vaccinated, as it were. Salomé Meyer joins us on the line in her capacity as director at Cancer Alliance.
Women who lead, women who lift, women who inspire. African woman. This is Women's Month on Channel Africa. Be inspired. Stay informed. Channel Africa, the beauty of life. Now available anytime, anywhere with our new app. Africa World Hour with Mpositole.
David Njumbe, who's a long-serving personal assistant to Tundu Lisu for over 15 years, on the night of 20 May, he survived a shocking abduction attempt just meters from his home. Talk us through what exactly happened on that night.
It is something that happened in my head. I expected to meet such situation for several months since the first attempt to abduct me was 6 months ago. There was a car car coming very speedy behind me. I let them go. Instead of going, more than 6 people came out of that car and attacked me and they said police. I started fighting back and they handcuffed me. Immediately they started beating me, and one of them was telling me, "You have been running here and there. Now it's your time, it's your day, it's your last day."
Africa World Hour with Mmatsheko. Catch it on the Channel Africa app, SABC Plus, and on channelafrica.co.za. Weekdays from 9 till 10 p.m. Central African Time. Every headline has a human side. The Journal with Mmatsheko Mosito on the African Perspective.
Welcome back to the program as we continue conversations during this Women's Month addressing matters to do with cervical cancer, because as we see it here in South Africa, women aged between 15 and 44 lose their lives every single year. 6,000 lives every single year are lost according to statistics, and we really are unpacking that, but really looking at how developments are coming up when we look at the support between the various stakeholders, government, the private sector, as well as civil society. Salomé Meyer joins me on the line in her capacity as director at Cancer Alliance. Salomé, let's talk about that. Let's look at how these stakeholders are working together, perhaps how civil society and the private sector can better support government efforts at this time. Okay, I think we've lost Salomé's line. We're going to take a break and return.
Before they were leaders, they were simply women who refused to accept that they didn't have a voice.
When an African woman has been put under pressure, when she's been socialized into a certain space and she is being that woman, that doesn't mean that's all there is to her.
They carried an entire continent of women through voices that hummed and ululated, healed and nurtured, and voices that preserved culture and impacted wisdom. In their voices, we heard how beautiful Africa could be. This Women's Month, we celebrate the voices who came before. We stand tall and speak louder because you did. Channel Africa, the African Perspective. Let the drums guide you through Amapiano energy and jazz sophistication on Jemba Vibes.
Somi Grammy-nominated jazz voice, Rwandan and Ugandan roots, born in the U.S. but claimed by the African continent. But she's also honored Africa's Miriam Makeba. I'm South African. I can't talk to you without speaking about Ginger Me Slowly. In fact, that song has brought so much pressure on us South African men and how to treat our women.
It's not a song that I don't want to sing, but there are times when I feel like maybe I want to have a set that's a little more like, I don't know, that's sort of brewing in other emotional spaces. I still feel like, but I should do Ginger Me Slowly. It's kind of a joke now with my band. I love that it's a love song that people want to hear and that it occupies a kind of warm energy center for me.
Feel the heartbeat of the African continent. Afro beats, jazz grooves, and dancehall fire unite on Jemba Vibes. Sunday, 9 p.m. till 12 a.m. Central African Time. Only on Channel Africa, the African Perspective. Every headline has a human side. The Journal with Mmatsheko Mosito on the African Perspective.
Right, we're going to wrap up conversations now looking at the theme of women's health and cervical cancer, which remains a leading cause of cancer-related deaths among South African women aged 15 to 44, and it's claiming nearly 6,000 lives every single year. So what is being done at, civil society, government and private sector level at this time to make sure that, hands work together and join together to really help bring those numbers down as we acknowledge them. Salomé Meyer is back on the line with us in her capacity as the director at Cancer Alliance. Salomé, I know you've got another engagement, but would really love to establish with you how civil society and the private sector can better support government efforts.
So civil society works together with government to create demand in our communities. And that is important that we understand the role of civil society. So without civil society, we cannot build the momentum for women to participate in cervical cancer screening. That means that we actually have to, similarly what we've done for HIV/AIDS, we actually have to make sure that we create that awareness in communities about cervical cancer and the importance of cervical cancer. And again, I do need to stress here that we have to make sure that we work with government so that we do not create a demand and then the supply side is not ready for the demand. And it is a very, very close collaborative relationship between civil society and government.
Absolutely, very critical. And lastly, as we wrap up, perhaps your core message. I think if we could leave us with a message this Women's Month regarding cervical cancer for those who are, affected by this particular illness in various ways, maybe even family support at this time.
Cervical cancer is preventable and treatable, and no woman should die of cervical cancer. And what we should do is we should create a supporting environment for our women in communities so that they can actually be screened, be vaccinated, and be treated with dignity. Thank you.
Thank you very much. Thank you, Salomé Meyer, Director at Cancer Alliance. I think it would be in every woman's interest, whether you have cervical cancer or not, to do some digging. Go to your local clinic, go to your local hospital. It doesn't have to just be women in South Africa, but women all over the African continent. We need to take our health back in our own hands and really find resources and places where we can get information, because you just never know. And prevention will always be better than cure in this particular context. We're 2 minutes away from the bottom of 11:30.
The Journal with Mmatsheko Mosito.